All right, hello everyone. I will be talking about diabetes and hypertension and how they are two sides of the same coin. In this module, we will be covering diabetes and high blood pressure, also known as hypertension, and how they are related. A lot of patients have both diabetes and hypertension. These two conditions also have similar effects and lead to the same diseases. They are also projected by specialists to increase exponentially globally in the coming years. It's projected that by 2030, we will have 439 million individuals with diabetes and 1.56 billion individuals with hypertension globally. There are common risk factors that can manifest in both diabetes and hypertension. These can include genetics/family history, your body resisting insulin, too much lipids in your diet, and obesity. In addition, diabetes can also lead to hypertension, much like how hypertension can lead to diabetes. Having these conditions can lead to factors which can eventually cause heart disease, which is why it's especially important to take steps to reduce your risk of developing diabetes and hypertension. All right, let's keep going. So this is another image showing the interconnection between hypertension and type 2 diabetes and how they can manifest in cardiovascular disease. Life's 8 essentials were created from the American Heart Association. They delineate 8 important things to do in order to have a healthier lifestyle. These can include eating better, being more active, quitting tobacco, getting more sleep, managing weight, controlling cholesterol, managing blood sugar, and managing blood pressure. So these are some diets that have been researched to show how patients can live healthier lives. These can include the Ornish diet, which is low fat, and some research showing that it can decrease aging, heart disease, and diabetes. The Esselstyn diet, which is low fat, low carb, and there's evidence for coronary artery plaque reversal. It advocates against the use of oils, which can even include olive oil. The DASH diet, which is low sodium, high potassium, and high calcium. It's specifically designed for blood pressure reduction. And the Mediterranean diet, which is very similar to the DASH diet, but it allows for more healthy fats to be included, such as olive oils and freshwater fish. Okay, so there was a study conducted to see how patients did on the Esselstyn diet, and they compared before and after pictures of the vessels in the heart. They found that the narrowing of the vessels was much reversed in those that had undergone this diet. And we can see that the vessel in the November picture is much narrower compared to the July post-diet picture. So, how many minutes of aerobic activity should you get a week? Specialists say it's important to get at least 150 minutes per week. How many times should you be doing muscle strengthening activities a week? To live a healthier life, you should at least have 2 days per week of muscle strengthening activities and ensure that they are on non-consecutive days, which mean not next to each other, so like Monday, Tuesday, Tuesday, Wednesday, and so on. And this will allow for good health. How many hours do you think you should sit in a day? So specialists say you should sit less than 8 hours a day. How many hours of sunlight should we get in a day? You should be getting at least 1 hour of sunlight per day. So this can be obtained by going on walks, even sitting outside for lunch. Some similar tasks like that can allow for a healthier lifestyle. Okay. So there is also a study conducted to show the effects of increased time sitting and not moving on death from cardiovascular disease. So cardiovascular disease is just a fancier way of saying heart disease. They found that increased time sitting and staying steady led to increased death rates due to heart disease. It's almost like sitting is the new smoking. So here's some examples of ways that we can exercise in our East Brunswick community. You can play pickleball, go biking, take walks, or go for runs, or even go swimming. Simple activities at home can also help us get active. These can include gardening or even taking the stairs once in a while. You can even do 7-minute workouts at home, and there are great videos to guide you through these workouts on YouTube. So the blue zones, these are 5 regions that are known to have residents who comparatively live the longest, healthiest lives. They have lower levels of chronic diseases compared to the rest of the world. These can include regions like Loma Linda, California, Nicoya, Costa Rica, Sardinia, Italy, Ikaria, Greece, and Okinawa, Japan. So this graph shows what those who lived to be 100 plus in Loma Linda ate. We can see that these people had a diet that largely comprised of fruits and vegetables, with over 60% of the diet being comprised of this. We also see that their diets are low in added sugars and fats. This graph shows what those who lived to be 100 plus in Okinawa ate, and we see that their diet's very different than the other one. It's more high in sweet potatoes, which comprised of 67% of their diet, rice, 12% of their diet, and other vegetables, 9% of their diet. Based on the blue zones, there were guidelines created to help others live healthier lives. These can include eating more of a plant-based diet, whole wheat, beans, drinking more water, and eating and snacking on nuts daily. It is also important to limit fish, eggs, sugar, dairy, and even meats. Now, this is a diagram showing what the 3 of the 5 blue zones have in common. And if we see in the middle, all 3 of them have a good family structure / social engagement, no smoking, plant-heavy diet, consistent to moderate exercise, and increased legume consumption among residents. So these are some things to think about when framing our own lifestyles. All right, so the APCEA's Lifestyle Change Program can help you decrease your diabetes prevention and exacerbation. So we have monthly virtual sessions with lifestyle coaches and healthcare professionals. There's even a buddy that can help you stay motivated and accountable. And we also offer health screenings to assess blood pressure, blood sugar, and body consumption and composition. And we also have the HEAL program taking place at East Brunswick Public Library, where we have in-person educational sessions discussing modifiable risk factors, online modules that cover basics around hypertension management and care, and also a longitudinal buddy system to support community members that want more support with their hypertension management. All right, thank you so much for listening.